Hello guys, let us learn about FIGO staging of fibroids, which is important for both theory as well as MCQ exams. The basic uterine anatomy is like in between, like in the center you have endometrium, in between you have myometrium, and at the end you have the serosa. The ones in contact with endometrium are submucosal, in the myometrium are intramural, and in the serosa are the subserosal fibroids. So when we talk about different names of the fibroids, the ones that start with letter S, that is submucosal and subserosal, are given 3 digits. Submucosal is given 0, 1, 2, and subserosal is given 5, 6, 7 numbers, whereas in between them, that is intramural, is given only 2 digits, that is 3 and 4. How to remember each digit and how to remember how much percentage of myometrium or serosa is involved, let us learn with the help of a diagram and using an approach called inside to outside approach. When we look at this label diagram of the uterus with variant fibroids, the one which is lined with the dark blue color is the endometrium. The endometrium lining is shown to you again. So I am lining all the endometrium with the blue color in order to appreciate the submucosal fibroids. The second one is the orange color one, which is myometrium. The digits, the numbers 3 and 4 are the myometrial fibroids, and the ones that is labeled in purple color is the serosa. And in this diagram, myometrium is shaded in yellow color for you. So from inside to outside, we have submucosal, intramural, and subserosal fibroid. Submucosal has 0, 1, 2. Intramural is given digits 3 and 4, and subserosal is given 5, 6 and 7, and others is labeled as 8. How to remember what? So the first one, submucosal, is 0. So it is a pedunculated submucosal fibroid. There in the pink I am shading the peduncle. So it is a pedunculated submucosal fibroid. Whereas 1, the yellow color portion, that is the myometrial portion, is only less than 50%. Whereas in fibroid 2, the myometrial portion is more than the blue color portion. So it is more than 50% intramural. So you are going towards outside, right? You are entering from the endometrium to the myometrium. And then comes the intramural fibroids 3 and 4. The third one is in contact with the endometrium. That is, only small portion of 3 is labeled blue there. So only that portion is with the contact of endometrium. Rest of in the myometrium only. Whereas type 4, it is far away from the endometrium. So when you look at the digit 4 there, it is far away from the endometrium. So it is purely intramural 4. Coming to the subserosal type, it is again given 5, 6 and 7. So how to remember? Both subserosal and submucosal are starting with S, but subserosal has 2 S in it. It is looking like 5, right? So remember, like subserosal, write like 5 and 5. So it starts with 5. 5, 6 and 7 are subserosal. So first subserosal, that is the 5th type of subserosal fibroid, it is more than 50% in contact with the myometrium, because it is towards the uterus only still. The 7th number will be much away from the myometrium. So the 5th one is more than 50% within the myometrium, whereas 6th one, there is only less than 50% within the myometrium, and the 7th one has a peduncle like the 0 one. So it is a pedunculated subserosal. So start with peduncle at 0, end with peduncle at 7. And the 8th one are cervical fibroids, parasitic fibroids, and broad ligament fibroids. So this is how the FIGO staging of fibroids is described. Hope you will remember by the end of this video. Thank you.